Everyone. I hope everyone has had a good week so far. We are trudging along day by day here at MDHS. This will probably be a short session unless you all have a lot of questions for us, which we will be more than happy to answer. For those of you that don't know me, my name is Chad Allgood. I'm the Deputy Director for the Division of Early Childhood Care and Development here at MDHS. Also from MDHS, I have Laura Dixon, who is DECCD's Policy Advisor. I also have Angela Crockett, who is our Subsidy Director for the Child Care Payment Program. I'm going to share just a couple of quick updates with you all. And then as before with other sessions, I will give you an opportunity to ask me any questions. I'll answer what I can answer. And the way that we do the questions is you type your questions in the chat, and Laura is going to moderate that for me. So, and any questions that we may not get to during the session, we are recording the session and we are recording the chat. So anything we don't get to, we will answer, and we will post the answers as well as the recorded information session on the information session website, which is on the CCAC website. And be sure to visit those. If you've missed any of the past sessions, be sure to go in there and you can watch all of the past sessions that we've had. The question and answer sections are up there as well. And then any future meetings, the links to any of those future meetings will be listed as well. So the biggest update that I have for you all is in reference to our temporary emergency filing. And this temporary emergency filing was done in an effort to support you all during COVID-19. We made an addition to it in that we have expanded the population of families, parents that are eligible for the emergency certificates. Prior to this, we were only accepting those that worked in the healthcare industry for these emergency certificates. But we have expanded the amount of CARES funding that we've received. We've allocated a certain amount of money that we are going to be using to fund these emergency certificates. These emergency certificates are only, or any of you all that are licensed or registered child care facilities, you may accept these families that have these emergency certificates. And then we have 14 temporary Secare sites that are also eligible to accept these certificates. But again, we're not expanding the temporary Secare sites anymore. We're not accepting applications for new temporary sites. So we're holding at the 14 that are approved. And you can actually go, I believe notification of the temporary filing was sent out. You can read for yourself, but I'll just give you a few examples of the different employment areas that we added. So we still are, of course, allowing those that work in the healthcare field, but we've opened it up to include things like repair technicians that provide in-home repairs, childcare people that work in childcare programs, teachers, cooks, directors, whoever. You're also eligible. Also, teachers in public schools or that teach in schools are eligible. People that work in the food industry, which includes restaurants, grocery stores, the people that are having direct contact with the customers, cashiers at pretty much any type business that are working, that are working day to day and having that interaction with customers. So cashiers in retail stores, department stores, dollar stores, drug stores and gas stations, sanitation workers, bank tellers, and public service clerks that may work at like your DMV, Department of Health, tax assessor offices, court clerks, county clerks, staff in hair, nail, tanning salons, spas and fitness clubs, staff in veterinary offices, health and city inspectors that are conducting the on-site inspections, so those that are actually going out and doing the inspections, and then staff members that work in hotels, motels, the hospitality industry. So we've expanded that population. Now bear in mind that this is not unlimited. We're using CARES dollars to fund these certificates, and that amount of money is limited as well, but we're going to open this up for as many as we possibly can. So that's that. I would also like to point out, we are not going to begin accepting these applications until August 1st. Is that correct, Laura? Right. So beginning August 1st, parents that are families that fall into any of these categories in this expanded priority population will be eligible to apply to get the emergency certificates. So that's that. If Laura or Angela don't have any updates at this point, we'll open it up for questions. If anyone has any questions, or Laura or Angela, if you have anything to add. I think that's a no. So, so if you all have any questions, we'll just open up the floor. I'll answer those, and when we kind of get to a point where there aren't any more questions, we will we'll end the session for today.
Chad, we do have a question. Could you just clarify that emergency certificates are still being issued? Some folks were sort of coming on as we were starting our session this morning, and they missed just that little bit.
Okay, sure. So we opened up what we call emergency certificates a few months ago, and initially those emergency certificates were for people that worked in the healthcare field. And the goal of the emergency certificates was to offer child care support for those folks that were considered essential and were having to work. They were not allowed to quarantine at home. That's been in place for a few months now, and with our recent filing, we've expanded what we're calling the priority population of folks that would qualify for these emergency certificates. And on the filing, there is a comprehensive list of the different types of industries that we would that we're expanding that to. And just a quick rundown. It includes, of course, healthcare providers are still included in that, but it includes like repair technicians, cashiers at a variety of different businesses, folks that work in food service, which includes grocery stores and restaurants, bank tellers, public service clerks, inspectors that are doing on-site inspections, health and city inspectors, people that work in hair, nail, tanning salons, spas and fitness clubs, and those that work in the hotel and motel industries.
Okay. So we have another question, and I believe it's related to child care program employees. They're asking if all center employees are eligible.
Yes, that is correct. All child care employees are eligible, yes.
Okay, and where will they go to apply?
It's the same, I believe it's the same link, that it's the same link for any other certificates. I do have that right, correct, Angela?
That's correct. It'll say the Secare emergency application. So
yeah, so look for
Secare
emergency application when applying for these certificates. Thank you, Angela.
Okay. We have a question about payment for school-age children doing virtual learning at the public school, but attending their facility all day.
So is the question, will certificates be available for those children?
I think the question is, how much are we going to pay?
If it is a school ager that is going from part-time to full-time, I believe we had said we would reimburse them at the full-time rates. But that's still something we're having to look at, because that's going to constitute a significant increase in the money that we're having to release. And we're going to have to determine, we're really waiting to see more what school systems are doing across the state before we make a definite determination about that, but we are looking at it.
Okay, and there's another question about why we used occupations for the criteria rather than the income eligibility for the emergency certificates.
Yeah, and Laura, can you actually speak to that about that we were waiving income, that income was one of the waivers that we sought from the feds?
Yep, so you just did, but we sought a waiver from the Federal Office of Child Care to serve emergency certificates without regard to income. So we did not want to base who was eligible. We did not want that tied back to those income eligibility criteria that we use for our standard processing. And so we followed the lead from the Office of the Governor in terms of identifying specific job roles and functionality during the pandemic, so that we could be aligned with those executive orders, since we were free from our normal constraints of approving or determining eligibility based on income criteria. Okay, another question is, whether or not the new list covers public school teachers.
So if, let me see, I'm going to pull up the actual. I'm sorry, give me just 1 second. My computer suddenly decided to go extremely slow. Okay, so the way it's worded, it says employees with regular direct customer contact in the following job roles: teaching, food preparation, sanitation, and reception staff within child care facilities and schools. So the answer to that is yes, teachers are eligible.
Okay, next question is, in terms of a lot of our programs that will be caring for school-age children, due to the way that the districts have elected to reopen their schools this fall, is there any contribution from school systems?
As of yet, no. These emergency certificates are being funded through our CARES dollars. And as of right now, we have not directly seen any contribution. Now, I have heard that there are some support systems that they're looking at doing, like the school feeding programs. And I think there has been discussion about making, so like, for example, the child and adult care food program, schools are making meals available. My suggestion would be for you to contact your local school systems to see if they have any potential support for you. Just have a very open conversation in that, if it's a situation where your school district is not going to be having children there on site, if it's virtual or whatever, talk to them about, you're a child care center that is going to be offering a place for these children to go. What is the school district doing to help facilitate support for that?
Yeah, we're getting that question a lot, that it seems like parents and then at the parent's choice, our provider programs are being asked to sort of change a lot of the way that they operate with these school-age children to support that facilitated learning. And we have just not been successful in getting a lot of response from districts about what exactly that should look like, what exactly they need and what their expectation is. That is something that we are working on our last information session. The participants answered several questions about this issue, and it is something that we've been reaching out to districts and trying to facilitate. We just have not been very successful. They, like all of us, have a lot of things going on, and so we're still pushing for that. We're still going to try and see if we can get that information out, and help, or at least help facilitate those discussions at the local level if they're not willing to, if they're not willing to put out anything in writing. But we are aware that that is a large concern. And so we are trying to facilitate that at that local level. So stay tuned for that. Okay, the next question is, are we going to still be paying based on enrollment, and if so, for how long?
We are going to continue paying based on enrollment. However, beginning August 1st, we will only continue to reimburse based on enrollment if you are open and caring for children. We're also going to continue to cover parent copays as well. And we will definitely be doing that through September. And we're looking at extending it beyond September, but again, we're having to constantly monitor the situation. We want to make sure that we are responsive to this pandemic as it changes, and we want to make sure that we're able to support you in as fully as we possibly can. But yes, we're definitely going to continue, like I said, to reimburse based on enrollment through September. But again, beginning August 1, you must be open and caring for children effective August 1 to continue to get your reimbursement. So so this month, the month of July, this is the last month that we will reimburse based on enrollment, even if you're closed.
Okay. Sorry. Let me get back to where we were. Okay. So here's a question that says, will we receive an email if we're one of the 14 approved sites for Secare? So again, Chad, I think maybe you should stress the difference between a Secare site and being Secare trained and sort of what that means.
Sure. So whenever we say Secare site, not Secare trained, when we say Secare site, we have 14 temporary child care centers that applied to be these temporary sites. Those programs have already been established and have already been through that whole process. If you are already a licensed child care center, or if you're registered, so licensed child care centers, or if you're registered, which means you would typically be like a license exempt, which includes family home providers. We do require you to become registered. So if you're licensed or registered, all you have to do is maintain your Secare training. And it's just an online training that you take. It's fairly quick. And once you take that training and submit your certificate, you are eligible for the emergency certificates. So you have your Secare sites, which are just temporary sites, and we're not accepting applications for any more of those. And then you have your licensed or registered programs that are Secare trained, which means you've taken the training that gives you some of those additional recommendations that you can put in place to protect you, your staff, the children, and families.
Okay, so there is a couple of folks have asked the exact same question, so I'm going to say it on behalf of that group. The question is, are there plans to offer direct financial support to child care facilities? I'm assuming that means in addition to the increased rates and the enrollment-based pay and the co-payment that we've already issued.
The answer to that is yes, we are planning to offer some additional financial support. We're still working out some of the specific details about how we're going to go about doing that. We want to be very careful in that, when we offer you this financial support, we're not placing additional burden of reporting or anything of that nature that might cause you to have to fill out more paperwork or things of that nature. So we are planning to do that, and you'll hear more information about that in the coming weeks.
Okay. Then we have a couple of questions about emergency certificates. And so rather than ask them all individually, I'm going to ask you a global question that addresses sort of the intent of a lot of them. Can you talk a little bit about how long the certificates last? There's some question about why some of the emergency certificates are being terminated, and then others want to have some information about the length of time that those certificates are being issued. So would you remind folks about that, about the length of time that the certificates are being issued for?
Sure. Emergency certificates are valid for 90 days at a time. And that's why some people that have been on those emergency certificates are receiving notification. We have to do a balancing act at supporting as many families as we possibly can. So we are limiting those emergency certificates to 90 days. Now, what we are doing is when a family is, I think it's 45 days. Is that right, Angela?
45 days. Mm-hmm.
Okay,
right.
So at 45 days into the emergency certificate time period, these families are going to be receiving notification that their emergency certificate will end on a set date. We are, however, offering these families the opportunity to apply for the regular 12-month certificate. So they do have that option. But that's why some people are receiving notification of the 90 days. Because again, there's a lot of folks out there that are needing help. We're trying to balance that. And you also have to keep in mind that we've had to, be adaptive. So, initially those emergency certificates were for those folks that were working in the healthcare field. But then we realized that, as more and more programs are opening up, we need to make sure that we're supporting families in other industries, and also make sure that we're supporting the child care programs, as you're offering child care, to these working families.
Okay, the next question is asking how much CARES money is left and how long they can expect to receive payment for the certificates that are issued using the CARES money. And I know you've talked a little bit about that those funds the certificates will be issued and until funding ends. And so I just would like to add to that before you begin to address your question about the CARES funds remaining and how long they'll be eligible, is that because the emergency certificates are intended to be a temporary certificate, they are not intended to be another 12-month process. They were intended to be temporary emergency certificates. That when they're issued, all those funds for those certificates are obligated. So you'll be paid for the full 90 days for each of the certificates that you're issued. And so I just wanted to add that point in there so that you shouldn't be concerned that you would be issued a 90-day certificate and then lose it after 10 days or 15 days. Once that certificate has been issued, those funds have been obligated for the remainder of that certificate. And so when we're looking at how much money we have left, we're looking at what's been obligated versus what is budgeted for that amount. So I just want to make sure that no one is concerned that they could be issued an emergency certificate and not receive the full 90-day payment for that.
Yeah, thank you for making that point, Laura. To answer your question about how much is left, well, we haven't run out yet. No, and I say that jokingly. We did receive a full $47 million. And as we have put these policies in place, we are allocating certain amounts of money to each of these support functions. So we have an amount of money that's allocated to emergency certificates. We have an amount of money that is allocated to covering parent copays. We have a certain amount of money that's allocated to, I mentioned the emergency certificates. So the additional financial support that I had mentioned, you know, all of these pots of money, we are trying to be very careful in that we're using our CARES dollars in a very comprehensive way. And as Laura said, if you have someone on an emergency certificate, it's good for the 90 days period. We're not going to cut the funding for that emergency certificate prior to that 90-day period.
Sorry, it takes me just a minute to manage all my screens on this side. I'm sorry for the delay. Okay, Angela, this one is for you. It's about ledger processing, and so I don't know if it's something that you want to address now or we'll be sending out follow-up instructions, but they want to know if they will code the school-age children as full-time.
The instructions will still be on the ledger like we've had previous months. But if your center is closed, you'll still use the emergency code DNR. If your center is open and kids are attending and they're school-age children, then you would mark the full-time F as full-time if the kids are in attendance at your center. And you will use your emergency codes if you're still closed at this time.
Okay.
Laura, let me say one more thing.
Yep.
When you're completing your ledger, if you are marking A's, remember that we are paying you for attendance by enrollment for your children for the ledger. So make sure that you code it correctly. So you shouldn't use A unless they're not coming back to your center at all, for that they're not enrolled anymore and you need them removed. But for purposes for this month, for the last month that we're paying, make sure that you code it correctly and not use the A's if it's not a true A, because we are paying you by enrollment.
Okay. Sorry, folks. So if you have guardianship over kids, will this cover those children? That's the way the question reads. I'm assuming if it means one of the folks that's, if a guardian of a child meets the employment eligibility for an emergency certificate, will they be allowed to apply if they have guardianship rather than whether it's temporary or permanent?
If you have legal custody of the child, then yes, you are eligible.
Okay. Here's one. Who do I contact besides the health department to let them know we closed due to 3 or 4 teachers and children having the coronavirus?
At this point, the health department is your mandate. I mean, that's who you should be reporting to. We also have a web form that you fill out, and you should have all received an email through the CC payment email that had the link. And on our last information session, I went through that letter that came through the email that shows you the link for reporting that. Is that Angela? Is that link on our website?
Yes, it's on the MDHS website. So they can find it there. And it's on the letter that we sent out to them on July 1st.
Okay.
It's the closures due to COVID-19 link.
Correct.
Mm-hmm. And it's on the MDHS website. I have them put there.
Let's see. Do you know, is that, I'm going to see if I can. I was going to see if I could find that where I could show them.
Yeah, I have it up, John. I can.
Okay. Can you share your screen and show where the link is?
Can you see my screen?
Yes.
Yes.
Okay. It's the MDHS website, and if you click, let me go back, sorry. You'll come to the MDHS website, stroll down until you get to early childhood care and development. And if you stroll down just a little bit more, the links are here for COVID, provider reopening closure, and then your training certificate if you want to submit it. But the COVID exposure is here. It's just asking your center name, number of individuals exposed, the age group, closure date, reopen, and then just check that the information is true and submit that, as well as if your center is closed, you can, or reopening, you can submit that information as well.
So Angela, they use the first link, the center exposure form, if they have to close.
Mm-hmm.
And then at the point that they're going to reopen, they use the second link to indicate that they are again open and caring for children.
Yes.
And I will also point out that before Angela is going to show you the link to upload your Secare training certificate also. But before, I will point out that if you are required by the health department to close because of COVID-19, we will continue to reimburse you in that event. Okay. That is the one closure event that we will continue to reimburse you if the Department of Health requires that you close down because of exposure. COVID-19, a confirmed case of COVID-19 or exposure.
Right. And we would call them and notify them of what code to use on the ledger once we get that reported case at the center. And then the last link is the Secare training certificate for submission of that. When you get it, it's just asking you, have you completed the training, your provider ID number, your provider name, and then just upload the training certificate and submit your responses. And that is it. If you've already sent those in, try not to send it in more than one time, because we're trying to make sure we get everybody in the system and to ensure that they're ready to go, before August 1 as well. So try not to send any duplicates in if you've already submitted it. Okay, there you go, Laura.
Okay. So our next question is from a provider who has a reopen date of August the 10th. And their question is surrounding the August 1 deadline. And so they want to know if they will still qualify for the August 1st criteria, even if they can't open until the 10th.
I believe, Angela, you'll have to help me with this too. I believe what we said is that at the point that you reopen, that's the point that you will begin getting reimbursement. Is that correct?
That's correct. So if she's not open until the 10th, she will only get paid from the 10th on. Anything from the 1st through the 9th, she will not. She will have excess on her ledger.
So just to clarify, the support that's been in place, whether you were open or closed, will not be in effect as of the last day of this month. And so for any days after beginning August 1 through their reopening day, they will not be receiving those automatic payments like they have been unless they are open.
That is correct.
Okay. Okay. Here's one that says the facility is open 12 hours a day and schools are going with late drop-off and early dismissals. What is the manic number of hours that would constitute full-time documentation versus part-time? So in terms of the, just want to summarize what Chad said earlier. In terms of payment for how we're going to be handling full-time versus part-time of school-age children and how all that is working, that is something, like I said, we've been looking into. As many of you know, some of you may be in this position. Not all school districts have published their plans yet. We needed to understand what the need was across the state so we could determine the best way to address it. That is something we're still having to look at here. So if your question is about school-age children and payment for full-time, part-time, and ledger claims and that kind of thing, all of that is going to be coming out to you in the next week or so. It's just we have not had the opportunity to get all of those things approved internally since we've been delayed, just like you all have been, by the late publication of the plans from the school districts. And then in many cases, school districts that have plans in place have now changed them. And so we're having to go back and update what we already thought we knew and sort of reevaluate. So all of those issues related to handling school-age children, all of that information is to come. I promise it's not something that that we are not working on. We're focused on that, and we are really looking at that and how we're going to be able to address it. So that information is still coming. So I want everybody to be assured of that. Okay. There's a question that is asking if there's a link to see the list of new eligible workers for the temporary emergency certificates, and I can answer that one. In the link that came out to everybody yesterday, there's a link to the policies that are filed on with the Secretary of State plan that will be effective August 1. That list is in that document. It's only about 10 pages or so. It's not as lengthy as our permanent set of policies. So that'll be there. The list that is on the CCAC website that was published originally, that will be updated. But in the meantime, you can go to, can click on that link that was in that email. The link is also available on the CCAC website. That information was updated, so the link is there too, where you can go and look at our policies that are on file that will be effective on the 1st. And look at those changes in that population group. Angela, if a parent does not have a birth certificate, can the school enrollment forms be used? The form seems to indicate that, but it is sort of vague. That's the question.
For which application are we referring to?
They did not specify.
For the You can use the school enrollment as proof. I assume we're talking about proof of relationship, or are we talking about proof of the child? Because that would be that. I would need to be able to clarify that more before I'm able to give a real answer. But if you're talking about relationship to the parent, then yes, the answer is yes to that. But if not, then we would need the child's birth certificate. If it's just for the child.
Okay. April, how can a provider verify if you already have a copy of their Secare training certificate?
Well, you would have had, we would, I mean, if you send it to us, then we've gotten to it. I mean, I don't know any other way to answer that. If they've submitted it through our web form, we've processed all of those Secare training certificates. So if they've sent it in another form, we would prefer you not do that because we're trying to streamline to make sure that we get everyone in. So we would, if you send it through email or through fax, I would prefer you use the link that we provided so that we can ensure that it's processed in a
Angela,
timely manner.
would you pull the links back up on the website for just a moment, please? I know it does not address this current question about folks that have already submitted, but if you have not submitted it, or if just going forward in terms of anything that you may submit to us, if you will, Angela's going to show us her screen here in just a second. I'll show you what.
As soon as I find it.
Okay.
Okay.
I'm going to show you a way that you can set that so that you'll have confirmation. The web forms are built in such a way that at the end, you can click a box that will send you a copy of what you have submitted. And so that would be your verification. See right here? Send me a copy of my responses right above the submit button. Going forward, if you are ever using a web form and you're uploading anything to us, if you'll click this, or even if you just complete any web form for us, whether you're uploading anything or not, if you'll click this box right here, then you'll get a copy of what you submitted, so you'll have that confirmation. Thank you, Angela. I just wanted to show folks that
Okay.
so that they would understand the benefit of that, not just another email in their inbox, which none of us really get very much excited about. So, okay, so there's a question about mandates for masks for children. If the county is under a mandate, do the children need to wear masks? What about the teachers, staff? The teacher, staff, and parents have been required for weeks. So, Chad, do you want to address the mask issue?
Yeah, I mean, Matt, as far as what you should do regarding your masks, we can't require that you wear a mask or not wear a mask. We do strongly suggest that you wear a mask in the child care centers. There's mixed debate about whether children should or should not wear a mask. Some research says yes, some says no. You really have to look at that on a case-by-case basis. I know younger children, I would say 2 and younger, should not have masks on for sure. And you really have to look at it, like I said, on a case-by-case basis. My recommendation is you need to do whatever your local governance requires. I know there are some cities, there are some counties that do require everyone to wear masks, and businesses, if that's the case, you need to follow whatever whatever ordinance is there. If there is not one, you need to use your best judgment with what you think, what you think is the right thing to do.
Angela, once the 90-day temporary certificates have expired, does the participant need to have an open child support case? And another piece of that question is, how long will it take for the participant to become approved for that 12-month certificate?
For the Secare certificate, the answer is they do not have to have an open
No,
child support.
sorry, Angela, I'm sorry, I wasn't clear. They're saying after that Secare certificate
Oh,
has expired and they're going through applying for the full 12-month certificate,
okay.
do they at that point have to have child support, and how long will approval take for those?
The answer to that question is yes, they would need to have an open child support case if they're going to the next step to get the 12-month certificate. In regards to the application being approved, we have made it to less than 30 days for an application to be approved, as long as it can be quicker if we get the information in and all the documentation and requirements are being met, then it could take less. But our time frame now has been less than 30 days, as long as everything's in. If items are not in, it takes a little longer for an application to be approved, because we are waiting on those items to come from the parent or to the requirements to be met.
Okay. So, okay. Okay, so another question is, aren't you eliminating redetermination right now? If so, why are applicants having to comply with child support? I can address this, Chad, and then if I don't hit it, you can come in. We had a phone call with the Federal Office of Child Care this week. They were very clear to us that we still have to track that families that we're going to receive the 12-month eligibility certificates fully are eligible for the program. We did not get waivers across the board for all types of funding situations. The government's not issuing those. So the child support requirement is in place for those folks who are going to be applying for a full 12-month certificate, because we still have to prove that everybody that receives a 12-month certificate is fully eligible for the program, and that is the requirement of eligibility for our 12-month certificates. Chad, did you want to add anything to that?
No, just that, we do understand that the child support requirement is a pain point for a lot of families. We are looking at that, but it is right now, it is a state law requirement. And until we can address that, we're bound to state law just as we're bound to federal law. So, we do understand that it's a pain point. We are looking at addressing it. We do want to make sure that, we are eliminating as many pain points as possible. But as of right now, it is still a requirement.
Okay. So at this time, Chad, there are no questions that we have not already addressed in the chat box.
Okay. All right. If there are no other questions, if I'll give everyone just a couple of minutes, if there's anything else that we need to, if anyone has any last minute questions, as we're waiting for that, we will leave the session open for a few additional minutes. If anyone has any additional questions that they want to pop in, anything that we don't get to, we'll address in writing. Thank you all for taking your time. I know everyone's time is very precious, but we do feel that, you know, continuing to have these information sessions and being able to engage with you in this manner is extremely important, and we want to continue to do this. We hope that, was there a question, Lauren?
Yes, but I didn't want to cut you off. I'm sorry. I thought you paused. I thought you were finished. I was going to try to jump in.
I was just going to say, you know, we do appreciate you all participating. You know, we will continue to be doing these information sessions for the foreseeable future. You know, we do hope that they're beneficial to you and not a waste of your time. We have gotten some really positive feedback from that. We also appreciate the opportunity to be able to, you know, engage with you in this manner as well, especially during a time when there's a lot of information floating out there. We feel this is just a really good way that we can, you know, lay to rest some misinformation and address your questions. And, you know, your feedback is extremely valuable to us. The feedback that you give us helps us to stay responsive and meet the needs that you all have. So we do really, really appreciate you taking your time to participate. And then we hope that you'll continue to do so as we have sessions in the future.
Okay, so sorry, there's another question that I wanted to clarify. We have a question wanting to know who we've been planning with for the choices that we're making with the CARES funding.
In regard to which program, like which part? Just in general?
It just says who have you been planning with?
For most of the programs, it's been internal. We have worked with some of our sub-grants, which includes the Early Childhood Academy, Mississippi Early Childhood Inclusion Center, and Mississippi State Department of Health, and in regards to programmatic things, as far as like the financial assistance that I mentioned, the emergency certificates that we're doing, the covering the parent copays, those have been internal processes. We have all of that is being handled through DECCD. We're not working with anyone on those pieces.
Yes, and I'm sorry, Chad, you didn't, I was not clear to you talking about the Secare planning piece in terms of how those funds are being distributed. I think the question is about our task force.
Oh, okay. Yeah, we have convened a task force, which is comprised of the leadership of the various associations that are, and these are associations of early childhood groups. And you can actually find that list of associations on, I believe it's on the CCAC website. It lists the representatives that have been working with us to provide guidance. We specifically chose the representatives we specifically chose these associations because they represent you. They represent child care centers. And we wanted to make sure that the task force was designed in a way that would give child care providers the voice. And we wanted to make sure that we gave child care providers a forum for speaking up about what their needs are, and also keeping DECCD advised about what it is that child care providers need. And that's really how we chose the task force. And the task force we've met a couple of times. We are going to continue to meet with them. They are advising us on on these different pieces. And I would recommend, let's see. I would recommend, if you're a member of an association, get with the leadership of that association, because I do know that these task force members are being very diligent at hearing from the people that comprise their different associations and networks, and they are relaying that information to us.
Okay. Apparently they did not answer the question that's asked. So I'll just add, Carol, I'll ask you to just send an email in that gives us a little more detail because I'm not sure what the question is, and I want us to go ahead and wrap up at the end of time. So just send us an email and we'll respond to your question there. Last question is, how soon does the Secare parent need to apply for a 12-month certificate? So Angela, those folks that currently have the temporary certificates, what's their timeline for applying for the 12-month certificate?
So when they get their 45-day notice, they have a deadline that's inserted in the letter that gives them the time frame for responding. So as long as they meet that deadline, we're trying to get it, you know, if they're eligible, we want them to go ahead and get on, because then we move them over to a 12-month certificate if they're eligible for the for that particular certificate. So it depends on when the parent was on the program in their 45 days, but we want to make sure that everything, the process is completed before the 90-day period is up.
Okay. All right, Chad, I think that's it.
Okay. Well, we'll leave it open for just a few more minutes if you want to type any other questions that you have in the chat box. With the question about who we're working with, you know, just shoot that to us in an email so we can maybe get a little bit more clarification. We were thinking this was going to be a short session, but we are in fact at the top of the hour. So I think it's great, you know, that thank you all again for bringing your questions to our attention. We appreciate that. I hope you all have a great rest of your week. Please be careful and stay safe, and we'll see you next time. Thanks so much.
Laura.